Welcome to this discussion on asthma and allergies. To begin with, what is the relationship between asthma and allergies?
Respiratory allergy is the reason for asthma basically. If you have a allergy, usually we take it when you get an itching. You think that there is a skin manifestation of allergy. Then you take it, usually say it is allergy. But if it's another manifestation, sneezing, it's also a respiratory. If the allergy is affecting the nose, you get the sneezing. If it is if you are deeper going into the lungs, the lung tissue is affected because of the allergy, or the respiratory tract, lower respiratory tract is affected, then you get asthma actually. So it's a different form of allergy itself.
Asthma, there are certain doubts like, can you develop asthma at a later stage in life, or do you have asthma in the very beginning and it never goes away?
It's all is possible. So you can have a childhood asthma, and it can be continuing with your lifelong, or because allergen, if you are continuing with the allergen, your exposure to allergen is continuing, you will be continuously asthmatic. And if sometimes there is some changes your immune system can overcome, because it may not be because of the single reason. Some people who had childhood asthma after teenage, or a change in the age factor itself can change, get rid of asthma, and they can get a relief. But in the old age or after 40 or 50, it can reappear also. That is depends on multiple factors. The allergy and asthma is actually, it's an immunity. It is related to the immune system. In the allergies or in the asthma, the immune system is reacting abnormally. They are unnecessarily, they are overactive. That is the reason for. So they are overactive because there is a derailment in the normal systems of the working of the immune system. So if you are able to correct that, or if you are able to avoid the allergen, you are reacting to some certain footsteps, or the usually for the asthma, there is many of the airborne particles, or it can be food also. It is not airborne particle alone. There are certain food also which can trigger this asthmatic reaction or the allergic reaction. So we had to find out and exclude, and also you had to immune system. Immune system has two wings. One is the inflammation. Actually, this is all this sneezing, asthma, and all is the inflammatory changes actually. Inflammation of the respiratory tract, in the upper respiratory tract, it will present as the sneezing and nasal block and all. In the lower respiratory tract, it will present as the asthma. So we had to find out which are the problematic things. If it is difficult to, more difficult to control the air quality, but you can control your food quality and your body composition. If you correct your body composition, basically the immune system is controlled by the fat inside your body. This particular omega-3 and omega-6, they are acting as a not just a storage fat, or it's not an energy alone. It is actually omega-3 and 6 fat is acting as like a vitamin. It's an essential thing. It has to be got from the food. And if the balance of this omega-3 and 6 also plays an important role in this immune system, and definitely the allergy and asthma is a problem of the immune system. So we had to correct that, and also to avoid the allergen.
Actually, when we talk about allergies, what is the different ways in which you can test and find out what is the allergy?
So now there are even the previously, actually, to test allergy, there was only patch test. You have a certain number of this allergen is injected into your skin, and it is marked and find out which is causing. So you can test only very few items actually. Now there are at least two clear-cut methods. It all depends on the lab also, how reliable and all. And I'm getting reasonably very good results about the IgE response. Actually, allergy is mainly IgE response. So you can know the total IgE level in your body, and also the which all substances which is creating IgE response in your body. That is food IgE response. You can get many food items, and also the airborne inhalant allergy, and also the uh, contact allergy. Some certain things, if you are wearing for like some are allergic to this rubber items, and so many plastic, so many items, even the soap and the detergent. So you can find out that contact allergy and also drug allergy. So certain medicines can also trigger. So it is, you cannot test all the medicines. There are thousands of medications, but you can test certain few medicines. At least the most essential medicines are actually antibiotic. At least one has to take sometimes antibiotic and also painkillers. So you can test a few of the certain, so commonly used. Usually the lab is giving a few antibiotics and certain very commonly used things they will test, and whether your body is having a reaction to that. So that will also help you to, for emergency situation, what medicine you can take it for. Actually you need to take only uh, this medicines like painkillers and antibiotic you may need. Every person can need, but other like medications for diabetes, hypertension, and all, you can avoid if you are, if you can come out of it, or you can avoid if you are willing to correct your lifestyle. So such things you can take it, and the other medications you can take it and see whether you are allergic. But this way you can test it. So another type of allergy you can test is also Ig. Those things you can test is in the blood itself. So you can get around 100 or 120 items, or around 200 items in different aspects. So from that you can decide which you have to avoid and which you have to select. So for that you just to go and do. I had seen patients coming with all the allergy reports and all from different labs and different type of reports. Even the it matters how to. It is only with the support only you can, with the guidance only you can use the allergy report in the proper way. So that itself, if different allergy labs shows that different type of reports you are getting, and the cost will be different. Some may be getting 3 or 5 or 8 items and very high charges. So the physician who's treating also should have a very good understanding. Just getting a report is not sufficient. So if you are testing for an allergy and all, you had to get a guidance from basically a person who's concentrating on the treatment of the allergy, or a person, I mean, person mean a doctor who is treating in the allergy oriented treatment, or a doctor who is treating lifestyle correction point of view. I'm basically doing the all the allergy problems are treating on the point of view of lifestyle correction. In that, it is very important to know what all things, the inhalants or what all those. There are so many things you can avoid. Actually, there can be, we have seen people who's allergic to perfume, allergic to paint. So such things, if you have allergy, you had to avoid it. And there are most women is allergic to this dust mite allergy. For the asthmatic patients, it is very common, and the dustmite allergy is the one which is most common and most the maximum allergic response which is seen also. So we had to guide the person to give clear-cut methods to reduce the population. You cannot avoid all these things, but you can give the measures to reduce the population of the this dust mite itself. Actually, dust mite is not really creating problem. The excreta of the dust mite is creating problem for you to sneezing and this asthmatic attack. Many patients who is getting an asthmatic attack or the sneezing in the early morning is because of the dust mite is one of the important, not only dust mite, but dust mite excreta is a major product thing for that. So we had to find out measures to reduce the population of the dust mite in your bedroom, especially.
Actually, when you are talking about asthma, generally the most common thing that comes to mind is inhalers. So, in your opinion, how do inhalers function, and what is it that a person can do if he wants to get off inhalers?
See, inhalers are having two different type of medications. One is the immunosuppressants, steroid type, and the other is bronchodilators, muscle relaxants. The bronchial muscle relaxants actually. They both has its own complications also. They can, if you are reading also, you should, if you are using any medicine, for as far as I tell my patients, if you are using, my patient doesn't need any medicines actually. After within a month or two, they will be out of medication from whatever medicines is there, they will be out of medication. And but emergency, but especially if this asthma patients, they can get this exposure from the air quality. No one can control because they will be traveling and all. Then if they even some food, it can trigger, and accidentally they take some food or inhale something, they had to have this inhaler and the medications, other medications also. Definitely medication has a role, but this these two medicines both is having problems, but it is the when you are taking as an inhaler, which is affecting only it is the action is mainly directly onto the lungs and the respiratory tract. So that way you can, if the same thing, if you are taking and orally, this first pass metabolism in the liver, you have to use a very high dose, and you are exposing all the cells in the body to this medicine. So the inhaler form is definitely much better. For example, if taking Derifilin every day, so you are taking the tablet very high dose, or the Derifilin, or this all this bronchodilators medication, you have to take a very high dose, and you have to bear the side effects of all that. But that way, this inhaler is giving, actually you can reduce the total impact, this dose, and also you can save other cells also from the, but after inhalation also it will be get absorbed into the body and everyone will be getting a part. But compared to the even the liver is freed from the heavy dose of medication, because liver will be has to metabolize it, and only the part which is left behind from the metabolism by the liver will be coming into the system. So one way it is positive that taking the inhaler, but the negative is negative means for my patients, for those who are coming for this clinically supported lifestyle correction, they may be initially they may be taking two puffs and sometimes extra inhalant or puffs they have to take. But usually they will be able to reduce the quantity into one, or gradually one morning and evening, then one morning or evening alone, and then it is SOS. SOS means when they feel it is once in a week or once in a month, That also they will be, because when we are clinically monitoring, we will be seeing that they had to find out also whether it is an inhalant, anything they are exposing additionally, or the food. Food we will be getting, charting it, and so we can find out. And we already have a list of possible allergens also already, when IgE mediated and IgG mediated we have already. And along with that, what is the other thing we are finding out? For the initial 3 months, it is the time to find out which is actually creating problem. Usually, most of the patients within a month they will be out from the inhaler, and once in a while they may be having. Even I have treated the patients who is on continuous medication, inhaler, and even this oral medication and inhaler for this, and with the interstitial fibrosis. Actually, next stage of the asthma development, or the it is not the typical asthma. Actually, asthma is an allergic reaction, and then if it is going into an autoimmune disease of the liver or of the lungs or the respiratory tract, it is even the nose, it can go into an autoimmune disease also. So in that case, even for the lungs, it is interstitial fibrosis or idiopathic interstitial lung disease. In that also, if the lifestyle is corrected, that is to avoid all these allergens, and also avoid even all the poisons or the toxins, even including the medicine. Medicine also, for the body is concerned, our immune system is concerned, all the medicines are toxin for them. All the medicines we are using for this, basically asthma, immediate result is from the steroids. They are immunosuppressants. They are actually quieting. There is an overreaction from the part of the immune system, and there is actually a derailment in the this inflammatory and anti-inflammatory nature of the reactions. Inflammation is the defensive and anti-inflammation is the healing. Actually, defense or inflammation is controlled by the omega-6 fat, and the anti-inflammation or the healing part is controlled by the omega-3. Actually, the another basic change in the food we had to the correction is needed is the omega-3/6 ratio in the food and also in the body. If you have to accumulated more fat, if you are obese or if you have a protruding tummy, that means there is excess fat in your body. If you are allergy or asthma patient, you may be having excess fat in the form of omega-6 in your body. So you have to get rid of that. Then only your immune system can be balanced. Only after this getting rid of this excess omega-6. Omega-6, you can think, you can understand that whether your body is having, you are obese and your body is having excess omega-6, you can find out that what was your food. If you are taking more nuts and more fried vegetable things which is fried in the vegetable oil, the fries and nuts are actually having more excess omega-6 in your food. Then omega-6 excess in your food and you are accumulating, that means your body stored fat also, and also each cell in your body is having a cover in the cell lining, and even the cell organelles, it is lined with actually a bilayer, fatty bilayer. So if the omega-6 is excess in that all different levels, in the macro level and in the micro level at the cellular level, definitely the chance of inflammation will be high, and that's one of the manifestation of the inflammation is asthma and allergy. And it can go into the next level, which is autoimmune disease, and in the next level is the cancer. So all these things are in the different level of inflammatory process. So if you want to control, if you want to come out of it, you have to do from the basic, from your food and the body composition itself.
What are the suggestions that you can provide to parents who want to prevent asthma from recurring in their children when they have suffered from it?
See, if you are prevent, it's a real prevention should start before you conceiving the baby. If you have asthma or any disease, or if you don't have any disease also, if you want the baby is of healthy, you should prepare from 6 months before, at least. So the sperm and egg, it starts at least 3 months before the conception time, conceiving. So the sperm and egg is meeting, and after 1-2 weeks only you are getting a pregnancy test also positive. So if you really want a healthy baby, and if you have the willingness to take effort in that, you have to start at least 3 to 6 months before and check your parameters. And if you have a family history of any disease, also check your parameters and correct it. So I'm basically my practice started in the reproductive medicine. I'm a gynecologist and specialized in the reproductive medicine and infertility actually. So even this clinically supported lifestyle correction itself is developed from my experience in correcting this infertility and other the recurrent abortions, infertility, and the recurrent congenital anomalies. And even I had experience in treating the patients who had diagnosed with the congenital abnormalities like a cleft lip and cleft palate, or the accumulation of fluid in the brain, and this spinal abnormalities, which are usually those things are diagnosed with the 14 weeks to 16 weeks you do a routine anomaly scan. In that, after diagnosing that also we had corrected with the correction of the food and the lifestyle. So if you are really interested, and if you are willingness, interest is not sufficient. You should be putting your time and effort and your everything should be there. Then you shall start. Before that, you check this thing and correct it with the clinically supported lifestyle correction, and even the conception time. Actually, the baby's genetics is decided at the time of at the time of ovulation. Then at the egg point of view, there is a division taking place. So there is one aspect. Then the female point of view, then is the penetration of the sperm into the egg. So there will be millions of sperms are coming, and only one will be penetrating. And then there is another division is taking place. So this final sperm selection and the final genetics of the egg is the matter. So if you are able to time that, and even with the modern medical facilities, you can even understand which is the time of ovulation, plan your consumption time accordingly. So you can for the genetics also you can if you get the sufficient effort, you can understand that. For that you should have a basic understanding and you should have an effort, and then it is all possible. And even you can get rid of all this. Even you can understand if you test your what are the things, and not only your baby, you will be also coming out of the asthma and allergy problems. You can find out the asthma, what are the things which is creating and which is actually transferring to your genetics only, to the baby it is transferring. Even the genetics answer to transfer of genetics, you can select it. So your will also have a major important factor in that. So I had seen that there are people who are having already the congenital there is genetic problem, that is chromosomal abnormality is there, but there is only 50% or 25% chance to transfer it into the baby. So they can get a healthy baby without the chromosomal or the genetic or this mutation defects. You can get it. So there is no 100% chance of usually there is not 100% if the mother and the father is healthy. Even if there is a genetic problem is there, there is not 100% chances to transmitting into the baby. So that can, if you give the correct nutrition and correct atmosphere for the at the time of consumption is the most important. And so for that you have to start your preparation before 3 to 6 months.
It is said that a lot of the allergic reactions that are happening have to do with the food that is consumed. So, what is it, or how can a person try to figure out what is allergic to him, what is not allergic to him when he is deciding on foods?
Definitely, if you are very sensitive and if your observation power is very high, you will be able to find out which is actually creating trouble for you. Like a respiratory point of which were about when you eat some item you may be eating or trigger or something like that. But the problem is you are when you are looking into the ingredients of our food, so much of items are coming. So that is very difficult to find out. For some, it will may be easy, and there are people who are saying that I have avoided this and I have relief, such thing. But if you can try yourself, understand and avoid. Avoidance and inclusion and avoidance is the simple method. But you have to eat, you have to get all the nutrition for you. So there it will be difficult. If you are not able to do correct it, and you need you are suffering or you are getting symptomatic, I mean suffering, or you are using medicines, then if you are not if yourself if you are not able to, then you have to get the support. So I don't know the type of support I am giving, whether you will be able to get anywhere in the world. Basically, the type of support I am giving is special food, which is ensuring all the nutrition in a special format. And along with that, we'll be adding for this allergy and asthma people, we'll be giving almost 95% of the all the nutrients which is needed. And adding, and they can also take some food which is from the not natural, the normal food. This is also normal food. It doesn't contain any color or preservatives or anything, and it is made from limited, very few ingredients actually. And making sure all the vitamins, minerals, omega-3, omega-6, and everything, the dietary fiber, all in the correct proportion. So along with that, we'll be giving we one by one we are introducing, and the everyone will be having different tastes, or even the will be likes and dislikes. So some are vegetarian, some are non-vegetarian, some are vegan. So even the religious kosher diet, halal diet, so many things are there. So the food, the nutritional support which is providing is go with any diet. It is basically vegan food, so it can be eaten by anyone. The other thing which you are eating, you can select from according to your preference, and also from the blood report, which is allergens and tolerance and such things also will help you to select food. And there are no methods to all the things, we will not be able to get it from the this test report also, and the test reports also may not be 100% sensitive or specific. So we will give uh, that point also in consideration. We just don't believe in blindly in any test, but we'll consider in the other aspects also. And we'll be adding or eat food every day and see that our aim is to find out at least 20 to 30 food items which is comfortable for you in the within 3 months. 3 months is the time which is complete support nutrition as a food. You are getting the complete support, and that time you will be able to find out at least 20 to 30 items which is nutritious and also available in your locality, and it is suitable for you. And then we can reduce the nutritional support, and usually in the next 3 months your nutritional support is reduced. By the time if you have excess fat in the body, that will also be get rid of, and your body composition, to correct the body composition is the one of the aim in the first 3 to 6 months. And also to allergy point of view, to find out which is comfortable for your most comfortable food which is available in your locality, and the least toxic or least manipulated food, like fresh fruits, vegetables, and the seeds, pulses, fish, meat. If you are a vegetarian or not, there is no need for, in this clinically supported lifestyle correction, there's no need for you to be a vegetarian, or you can take the non-veg items also. There are so many people you cannot, because the taste and their intestine and your system will be uh, set according to your parents' genetics, and also your food from your childhood. So you may not be able to just get rid of those who are using non-vegetarian, and they may not be able to get rid of those things that easily. But if they want to shift also to vegetarian food, they can definitely gradually they can change over. So many people who is eating non-vegetarian and they cannot stop such things. So you can take the this non-veg items also. That in Kerala, where I am practicing, the most of the people are not taking fish and meat. Even the Hindus, even the because that is the system here. There are very few vegetarians only here. So they are very happy if they can have some non-veg items, they are happy. So it is easy actually for the patients who is having cancer, and diabetic patients and cancer patients. If they are eating non-vegetarian, it is very easy for me to give advice, and also to make them satisfied with their food. And vegetarian is more difficult actually, especially when your point of view of the control of the cancer patients, it will be little more difficult for to make their satiety or satisfaction on the food.
Actually, egg and milk are basic diets for children. But in children, it is said that 1 in 50 children will be having egg allergy. And milk allergy is also seen to be common. So, what can be done to take care of such an issue?
See, if it is allergic, they had to avoid that food. And also the problem with the milk, we are, see, a few years back, when a child is born, then this goat or a cow is designated for that child's milk actually. In our place actually, when my childhood, we are always having this goat. One goat will be for the, even there was a custom in our society to give a goat or a cow along with when the child, this mother is gone to her husband's place with the baby after delivery. When the mother and child goes to the husband's place, this goat or the cow also is given. That was the customs in Kerala. I am telling, in my childhood days, that was in our community. So that was his custom. So the child will be getting, and to assure the child is getting enough milk. But here now that is not possible. Even when Mike, that is why childhood, when Mike is marriage and pregnancy and all kind, it is not possible actually. That time is past actually. So now the problem is this packaged milk. So many, that itself is not really milk. That is actually toned milk. So it is so much of processing is happened. I mean, even that ghee, that is actually the omega 3, omega 6, this DHA, actually this DHA is in the milk actually. And this fat soluble vitamins, all are removed. Because the fat is toned milk, the first initially the fat is removed and some part is there. And I don't know how much is there, and finally how much this omega DHA and all is there, it depends. And all those, also the quality of the milk produced by the cows, because that time primarily they are supposed to have some sunlight and they are grazing the green is this green leaves they are eating. But now it is more mainly of artificially fed the cows itself, and so many processing. And even in our place we are saying that can be antibiotics added in the, I don't know what all, that is all FSSA concern actually. So the milk is not the real, the old, the cow's real milk nowadays. Maybe that is the reason for the allergy. Anyway, I'm seeing so many people who is, we are doing with the test itself, so many are allergic to milk and also egg. The usually younger age, comparatively, maybe if you do the young children, the egg allergy is not that much, but the milk allergy is increasing with the way I don't get actually below 10 years, we don't really involve in the lifestyle correction. And usually after 14 years or 15 years, my experience is with the more with the adult people. Adult, when we are doing, there are so many are allergic to milk and also egg, especially the egg white. Allergy also is very common. So if there, if we when during the treatment also, if they find out, then we are asking to avoid. And after some time, the whole things is settled. When the patient is symptom free and the body composition is corrected, then they can take once in a while some milk tea or some little ice cream if they are interested, or some egg preparations, which is even the ice cream contains the egg and the milk also. So such things once in a while they can have. They may not be affected at all. But if you are continuously taking it, the allergy can reappear. So it is a balance. Your immune system can tolerate some allergens and all. So if it is so much of allergens, so much things are coming, then their poor immune system can't do any more. Then it is acting as a allergy and diseases. And it can go into, and just as I said, sneezing, asthma, itching, then autoimmune disease like psoriasis, eczema, then other things like internally also, the same things are happening in the inside also, the intestinal system, same mechanism. So if you are eating something, it is not going to the skin or the nose only, it is going everywhere. So it can present as a cancer also. So you are pushing your immune system to the limit while taking all this intolerant food and too many items. That is also another problem. We are adding too many items into the food and too many preservatives, coloring agents. So many, there are generally considered safe grass items are there. There are so many food ingredients, which is artificial ingredients, which is of no food nutritional value. is added into the food, and it is approved by the authorities also because of the preservation and taste. Food industry, the taste is the thing. So we are forgetting what you are eating for your nutrition, for your growth, for the body's maintenance, but we are now considering only the taste. So if you are much more concerned, no one is looking into what you are eating and what is the ingredient of the food, what are the safety of it when you are eating. But when you are filling your car with the fuel, you are more concerned. You want the correct fuel. So you will be very concerned about the car's fuel, but you are not concerned about your own fuel. That is the problem now.
Actually, when we are talking about asthma, how is it different from bronchitis, which is also very common in many people?
See, bronchitis and asthma is two different aspects actually. Usually it will be together also. The bronchi is the respiratory passage. So in the bronchi, there is muscle and the collagen. That is, you must have seen that round things are there in the picture. In between the muscles and collagen, that is cartilage actually. It's a type of bone, soft bone. So in the bronchitis, this collagen also is getting damaged, and also it can be damaging the muscle also. So there will be accumulation, and basically this in asthma also there is this collagen and the muscle contraction and all is happening actually. So it is not that independent. We cannot say that one is there and the other is not there and all. So in the bronchitis, basically this collagen and this cartilage of this thing, and also muscle also is damaging, and there is excess secretion from them. When the allergen comes, that there also this allergic factor is there. Allergen comes, the secretions is coming, and that is filling up this and also edematous. This even in the asthma, when the allergen comes, this mucous membrane is getting edematous, and that is actually constricting. Actually, they are trying to prevent this allergen. They are considering it as a toxin, and they are preventing it to go into the system. So the muscle is contracting. This is blocking. So the air cannot go inside. You need oxygen. It is not getting into because this air also contain or the food which is created this contraction. So both is actually in the different aspect of the disease actually. It's all comes under the lifestyle diseases. So for me, for controlling this clinically supported lifestyle correction, the basic approach is the same for just skin allergy, sneezing and upper respiratory allergy, or the lower respiratory allergy like asthma, or the bronchitis. The principle is same: to correct your body, your immune system, your hormones, your body composition, and then naturally you can correct it. Real doctor is the immune system, your own immune. Everyone has a doctor inside, everyone. So the physical doctors like us is actually the modern medicine or the homeo or the in our so many systems of medicine is there. Ayurveda is there, Unani is there. Everywhere what is actually trying to do is to strengthen your immune system. For the strengthening of the immune system, modern medicine point of view, at least helping the immune system. That this antibiotic will help the bacteria or the viruses to get rid of, there will be killing, so that will be beneficial. Or the vaccines will prepare your body, your immune system for coming attack. So when there is a wound is there, your stitching and the correction of the damages are approximating the tissue, so the healing will be helped. Or the bone is broken, you are trying to correct it. Those things are wonderful job we are doing. But for the point of view of the asthma, autoimmune allergy, autoimmune diseases, we are actually suppressing the immune system. So they are overreacting, make them quieten. So that is the thing we are doing. So it can, it's only the time when the medicine is acting, you will be getting result. After that, the system, that is the way the lifestyle diseases, lifelong medication. But if you are able to correct the lifestyle, and the problem with your everyone is born with the genetics, and there may be some predisposition for a disease, or some it's a familial asthma is familial. So you can modulate the this manifestation by correcting the lifestyle and finding out the problem with the what is your triggering the factor and avoid it. And that way you can really, you will be able to live comfortably, not only in point of asthma and allergy, in point of view of the diabetes, heart disease, even cancer. There are familial cancers also. If you are able to strengthen your immune system, which is the real doctor, which is inside everyone, and strengthen it, and then we will be able to get out of the disease. And that you should not expect. You can strengthen your immune system with the medicines. Actually, all the medicines are actually a stress for the immune system. Only this balance, you know that antibiotics, even taken, there can be complications, can get a kidney failure, even the hearing can be lost with some of the antibiotics, and so many complications, liver, kidney can. So when you are taking antibiotic or this such things also, you should be very careful that this kidney or the even the bone marrow suppression, all the cancer medicines, bone marrow suppression. Even the bone marrow suppression, means bone marrow is the one which is making this the producer of the immune cells. So you are actually blocking the immune system itself by anti-metabolite medications in the cancer treatment and all. Actually, you're blocking the immune system. So that is why actually in clinically supported lifestyle correction, we are strengthening the immune system. We strengthen the immune system and make this immune system to do the work. Chemotherapy, they have all the equipments, chemotherapy, surgery, everything they can themselves do if the immune system is powerful. So they can get rid of all the cancer cells or whatever the problem. So all these things you may not be able to look into the modern medicine, medical books or anything like that. So this is actually my experience. I'm telling about these things from my experience and my understanding, and that is not just understanding, and just that is with this by giving this clinically supported lifestyle correction. So many of the things, the concept also is basic concept is there, and also from my own experience in treating this clinic patients with the different type of diseases, including this asthma, allergy, autoimmune disease, interstitial fibrosis. When we consider the lung point of view, the interstitial lung disease, this autoimmune disease, and also even the cancer patients. Even I had seen cancer patients who is having fourth stage cancer already. Even the kidney, with the kidney and the vena cava, that so many extensions, and having, because of the this lung cancer growth inside the varicose veins in the hands also. But even that also can be reduced if the patient is willing, and the patient had very good response also, the fourth stage of cancer also. So there is no medication. There is nothing too much to do in the modern medicine. Also in the first stage, already spread many places. So even with that, the lifestyle correction in the food has a major important role actually. And for the cancer point of view, there is definitely this cutting the carbohydrate, cutting the glucose, even for the this lung cancer and all, or any cancer. Actually, we are this PET scan. Actually, we are using the radioactive labeled glucose for finding out the cancers. The same principle we can use in the for the treatment also. So it is very simple also when you are considering it is so simple. Even this lung cancer, one of the cancer marker is CIFRA 125 or some one cancer marker is there. And I had seen many patients who is positive for that can be, especially we do that test in the smokers who are suspecting a possibility of lung cancer and all, we are doing the CIFRA also. So in that case, who are positive also, this the value will also come down. So whenever a cancer, especially lung point of view, we'll check for this tumor markers also and see, we can see the progress with the tumor markers. And whoever is, there are so many cancer patients I know all over the world. And whoever is on cancer or unsuspected on treatment, always remember that reduce your carbohydrate intake. Reduce only, you just cut your carbohydrate intake. You use other things for your, so I can't say what to eat and all. So for my patients, I am giving special food with a low carb food, and also the other things they take also, to ask them to take such things which is containing very minimal carbohydrate. Any minimal carbohydrate which is absorbable, that is the child converted, can be converted to glucose, is the leafy vegetable which contains mainly the cellulose. That is also carbohydrate, but cannot be digested by our system. So if a cancer patient is, if someone is lung cancer or any cancer, you just restrict your diet to leafy vegetables, and also to, if you are non-vegetarian items that also doesn't contain much of the carb, that is which is minimum glucose, this is only small quantity. So you can, by these two measures, by cutting the carbohydrate itself, and the leafy vegetables will be having there is a most nutrition rich also. If you are taking reasonable quantity of the leafy vegetables, fresh leafy vegetables, preferably organic grown, and non-vegetable items, you can see if you are suffering from cancer, if there is any cancer marker, you can see which is coming, or there is any swelling. If it's a breast cancer, you can see it is reducing in size and it is becoming comfortable. You are becoming comfortable. And also, if you can check it with the PET scan, and also the other scanning, ultrasound scan. Easiest and the cheapest is the ultrasound scan. Ultrasound scan you can monitor for monitoring. You can use the ultrasound scan. So for any cancers, when we are monitoring, I'm using ultrasound scan every month. And if an active really cancer, then use the PET scan every 3 months to see what is the result. And the most important, if the cancer patient is a diabetic patient also, the control of the sugar is the most important thing. And usually for the diabetic patient, our aim is to bring down the HbA1c to 5.5. But for a cancer patients, we prefer to bring down the HbA1c to less than 5. We'll also show the amount of carbohydrate to starve the cancer center. That is the principle here.
With this, we come to the end of this discussion. Thank you.